Well, I have the top of the hour at 1 o'clock, so we're going to go ahead and get started. Thank you all for joining us. During today's webinar, if you are connected to Zoom, you'll have two ways in which to interact with us, both the chat window and the Q&A. A question was already asked this afternoon about the difference between these two items. The chat window is more for you to put in information about what your utility or company is doing and things that you just want to share out with the audience at large. Question and answer is more into asking a specific question to our guest speaker or to either the chairs that are speaking at this time. So feel free to put in chats, discussions, again, just interaction between the other participants that are on the call. A question and answer is a little more formal question that will be asked to our speakers. To take care of either one, we just ask that if you will, please click on the to box that's on your chat window and then change the selection to all panelists and attendees. When you do this, that just enables not only those that are speaking on the webinar, but also those that are in listen-only mode to be able to see your information, your interaction. If you have a question that you'd like to be asked to the speakers, type it into the Q&A box and then click send in that lower right-hand corner. We'll get to the questions as best as we can throughout the presentation, and we always have question and answer time at the end of the webinar. If you are interacting through YouTube Live, there's also a chat window there. I will be monitoring that throughout the webinar, so feel free to put in any comments or suggestions, questions that you might have, and we will bring those into the webinar at the best of our ability. Today's webinar is recorded. We will be placing a link to the webinar on our website, and that's at vawarn.org. You'll find them on a special WARN webinar webpage. And with that, we will get started. Mike?
All right, thank you, everybody. Sorry, a little trouble getting the phone to click over there. Thank you for joining us today, June 17th, for our COVID-19 WARN informational webinar. A lot of the information today is going to be around COVID, but as some of you have been dealing with the weather, there's many other things that the WARN can provide besides just COVID updates. We're here for hurricane assistance. We're here for flooding, mudslides, anything that you may be experiencing that's overwhelming to you or your utility and you need some assistance. By all means, that's what the WARN's here for. All right, next slide. So I want to thank everybody who's joined us, our state agency partners, ODW, DEQ, DPOR. I think we've had a few people from the State Corporation Commission that have been on, so I want to thank everybody for being here. Our ongoing WARN membership, we're seeing a steady growth in our WARN membership, actually. So we want to thank all of our WARN members, those that have recently become members, for joining us. Our Virginia utilities who are not WARN members at this time, we want to thank you for being on, sharing your information and the exchanges and the chat information that you have, and any additional Virginia partners that we may have listening in, whether you're a consultant or you're under contract with the utility and you just want more information. We appreciate you guys being here. Next slide. So today we have a special guest. We have Kevin Morley, the Manager of Federal Relations at American Water Works Association out of Washington, D.C. Kevin's been a pretty good advocate. Well, not a pretty good, he's been a strong advocate for the WARN program and a Virginia WARN push for us. It's a good resource having him in our own backyard. So we're going to turn this talk over to Kevin Morley, and thank you for joining us.
Hey, thanks, Ike. Very much appreciate joining y'all here. Since I am a resident of Virginia, I very much appreciate the support of VA WARN and what you guys do. So in talking with Ike in Geneva about this webinar, thought it'd be appropriate timing to share a little bit of information from the national level on what I would call COVID impacts, some key issues and observations, and kind of what I would call look ahead or considerations of how you kind of take this calamity that has kind of rocked the whole world, uh, and kind of leverage that for the benefit of some of the things you need to be doing as a utility. So, next slide. So really, at the beginning of this, what really broke down and what I'll talk about here for the next couple of slides are kind of four kind of what I would call big picture issues. One obviously is workforce, and that kind of speaks for itself, and I'm sure y'all have experienced that, but I'm going to share some of our observations from a national set of surveys. Obviously, there's been supply chain issues, and uh, we'll talk a little bit more about that when I get to that slide. But the Warrens played a very important role in dealing with some of those supply chain issues relative to well PPE. There's certainly some really important things as uh, I uh, I think maybe talking about the different phases of reopening businesses, and I'll spend a minute here talking about return to service and critical things that utilities need to be thinking about in communication with their customers, and uh, spend a minute on the financial impacts, which are uh, at a national level potentially pretty significant on the water sector, if not the whole country. So let's kind of dig into this a little bit more. Next slide. So from a workforce perspective, as we surveyed utilities, it was really encouraging to see that the majority of systems indicated that they had quickly adopted the CDC guidelines for social distancing and hygiene. And I know, and I'm sure you guys have talked about this before, but a number of utilities have gone to many different variants of modified work shifts and schedules to ensure continuity operations. And uh, for the better part of the last several months, I've been having weekly phone calls with all the Warren chairs around the country, and kind of just taking the temperature of what's going on and what the challenges are, and in, uh, just to a testament to utilities kind of adaptive nature and resolve to maintain the mission. We have not seen or been made aware of, at least, any significant operational impacts. That doesn't mean that folks weren't challenged with staff going out on quarantine because of uh, family member or whatnot having to be maybe exposed or something to that effect, or uh, and I know that there unfortunately have been some loss of life amongst the utility community in different areas because of COVID and the danger that that poses to certain folks. But again, utilities have been pretty adaptive and been pretty uh, good about doing some different things. And so the screenshots I have there are just some materials that we have up on our Corona virus website of just different ways utilities have uh, thought about the decision process for staffing and managing some of those potentially complicated HR issues, and some ways to kind of communicate and think about, hey, so John's a utility employee, and, he went to dinner with Lauren, and, she's not a utility employee, and, because of that, do I quarantine, or what do we need to do to change our protocol? And so those are just some resources that are out there that can help work through this. And I will say, you know, COVID is not the first, nor will be the last pandemic. And I think some of these staffing strategies, if you haven't already leveraged some of these resources, they're freely available. I'll have a web link for you here and on the last slide that you can go grab this stuff, and really encourage you to kind of think ahead and how can you incorporate this into some of your planning and business continuity planning. Next slide. So yeah, here's just a shot of the data, and just this is from our third survey that closed out. I guess it was late April, early May, and some of you may have responded to the last survey, which I don't have quite the result on, but it's a little bit of a look back. But as you can see there on the left, you know, social distancing and shit.
Kevin, you still with us? If you are, we're not able to hear you. I apologize for the inconvenience here. We'll try and get Kevin back and get him on the line.
Sorry about that. Disconnected somehow. Sorry about that.
Glad you're back.
Yes, sorry. We're resilient. So as you can see on the left-hand side there, you know, social distancing, modified and increased disinfection of workspaces and common and shared areas were really kind of implemented very quickly, and masks and all that stuff. So next slide. So the other really big issue, and this kind of evolved a number of different ways, and you can see Virginia was very, very involved there down at the bottom. And I'll talk about that. But the number one challenge for utilities was PPE and the ability to restock. And as a result of some of this survey work and verification across the sector, that this was a really big issue for us to be able to kind of maintain service and get out and do what we do. We were able to work with EPA and some of our partner organizations to secure 3 million reusable cloth masks for all 50 states, DC, Puerto Rico, and the Navajo Nation. And what was really wonderful about this, going to Ike's point about the value of WARN, and WARN had never done this before, but we got the WARN chairs together very quickly and came to a consensus process that we would facilitate and use WARN to be the points of distribution for these cloth masks, which don't replace N95, but certainly take a lot of pressure off the utility as they maintain certain work environments. And so you can see Geneva down there doing her thing to distribute those cloth masks to all you folks in Virginia. So we're grateful for that support and the utilities that helped her with that. The other thing that was really encouraging is that production and access to certain treatment chemicals, obviously the first and foremost was chlorine. We had assurances from our partners in that sector that there was no issue, and that really the concern would be in what I would call the last mile, right? So the ability of those repackagers to deliver things to the utility because of constraints on the trucking process and availability of workforce there. And so what we did see is a little bit of a stretch in when utilities might receive a delivery. And so again, from a planning perspective, you know, utility really wants to make sure they know where they are in that kind of restock or resupply of those critical materials to support their operations, and really have a good communication with their suppliers, and even think about alternative suppliers. It's one of the unique things that did come out of this, and I'm not sure this is a major use here in the state of Virginia, but because nobody was going to work, or not as many people were going to work, ethanol production went down. And as a result of ethanol production going down, one of the byproducts of that is carbon dioxide. And there are some places where, because of their proximity to those ethanol plants, CO2 is used for pH adjustment over sodium hydroxide because it's cheaper. Well, when those plants go down, all of a sudden there's no source, and it really created some of those entities implementing force majeure and all kinds of interesting contract issues and it really had the potential to impact utility operations. So thinking about some alternative options where you might source some material, that is very good. Uh, that for you to think about that and put that into your emergency planning. So next slide. So here's just a look at from some of the data relative to some of the supply chain issues, and as you can see on the left hand side, PPE was really the thing that was really putting a lot of pressure on folks at the time, and over on the right hand side, there was very few entities that were indicating any concerns about treatment chemical supply chain. And then there's a few other issues in the middle, and we'll get to the revenue one in a little bit. Again, that was kind of early to mid to late April. So next slide. And then this is just kind of carrying through on the ability to restock some of that kind of those PPE items. And you can see the N95 mask, which is really important in certain job positions, particularly wastewater. The cloth mask isn't really sufficient for that kind of work environment. And you can see in other cases, obviously the sanitizing sprays and wipes, as we all know from our trips to the grocery store, were very hard to come by, at least for a little while. Now it seems like they're back on the shelves along with toilet paper. So next slide. So as we're moving into, up here in Northern Virginia, we just got into phase 2 finally. And hopefully we'll all be moving into phase 3 in a not too distant future. But if you haven't already, I would encourage utilities to have communications with those businesses, schools, and other commercial sites that may have been dormant for the last several months, and as a result would have significant stagnation of water in their service lines and indoor plumbing, which can cause water quality issues that a utility manager is not going to want to deal with if they don't have to. And so there's been some good guidance developed in a number of different realms. Some material from CDC. EPA has a little bit more detailed guidance that is available as well. A number of state primacy agencies have shared out guidances in what should be communicated. And then there's been some other materials produced by some other entities such as Purdue and a group called the SPRI. So the financial impacts, $13.9 billion. This is based on a study we did with Raftellus. I'm not going to spend a lot of time on this, but this really helped us in some of our conversations and continues to help us with some of our conversations on the Hill to seek some stimulus funding should that next round is under discussion right now. Came out of the House, it's under review in the Senate, so we'll see what happens. Make no guarantees of what happens up on the Hill, but that is something that is informed the conversation. Next slide. So looking ahead, so how does this, I'm going to try to hit a couple real quick questions here and turn it back over to y'all. So how does this impact OEA compliance? Have we effectively operationalized our emergency response plan, and what threats might be we overlooking? So next slide. So I'm not going to spend time on this. Hopefully you've already been, this has been drilled into you, but these are the OEA compliance deadlines. There are really simple ways to get this done, and we have a number of resources to help you do that, along with resources from EPA as well. So hopefully you're moving forward. What I will emphatically say is there is no extension. There is no modification. These dates are fixed in statute, so do not expect any kind of extension due to COVID. That does not mean that EPA will not have some deference if that is the case, but it does potentially result in a $57,000+ a day fine for each day that you miss it. So it's really not worth missing the deadline, and we have resources to help you get there. Next slide. So these are the resources, as I mentioned, that we have available. So I'm going to focus on a couple there highlighted in red. Obviously, y'all are familiar with Virginia Warn, and there's like zero reason not to be a member of that program. It is a great opportunity to have a force multiplier at your side when push comes to shove. And so, sorry that the stuff on the left got a little jumbled up, but we have a number of standards on which a lot of our WIA compliance training is based on. And hopefully, you can use those to help you demonstrate your due diligence. I'm going to focus the last couple of minutes here on resource typing and cybersecurity. Next slide. So resource typing, right? So in short, some of you that have been around Warren have heard me or other folks talk about resource typing based on what we did in 2008. As a result of our experiences over the last several years, we found that there were things that need to be updated. We were very thankful that we were able to enter into a memorandum of agreement with FEMA to update that stuff together. And last year, we issued the new water sector resource typing guidance, which now populates FEMA's database. So again, the important thing here is that you have water utilities defining the type of resources that are really important. And so the reason I want to bring this up is in the ERP provisions, right? So the first deadline for the large system is coming up in September, specifically requires a utility to identify equipment that can be used in the event of a malevolent act or natural hazard. Well, Kevin, I don't have, a type 1 water main replacement team. That's fine. Part of the benefit, there's two ways that this resource typing material can be used. One is to take an evaluation of what you could potentially provide to somebody else. It also, by going through the process and evaluating those materials, tells you what you can't do and or what you might need to ask for and how to properly ask for it. This becomes important for those really large events where our friends at FEMA may become involved, right? Because they're going to be looking for standard language. They're all about standard language, incident command structure, and all that good stuff. So, I would encourage you to become familiar with this, understand what kinds of things that you can do, because the value of this in an incident that could potentially come up to Chesapeake Bay, for example, when I went out and asked the Warrens in the greater Texas area, if you will, who would be available to provide certain distribution repair teams, I got an email from a utility in Colorado 30 minutes later about the specific team that they would be able to deploy. That's expedited response capability. They didn't have to go think about it because they've done this, and it has standard language by which you can describe the assets and resources and folks that come to support you. And that became very instrumental in helping the utilities that responded to South Florida to bring those teams in from Tennessee, North Carolina, and South Carolina. So that's an opportunity. Next slide. The other thing that I want to bring around and close it out on is cybersecurity. This is by far, no debate, the number one threat facing all of critical infrastructure, right? And so we have developed a series of resources that are recognized by EPA, DHS, and the National Institutes of Standards and Technology. And what you can see there on the slide, we have two different things. The risk and responsibility document. If leadership is not convinced that they need to focus on this, there's some good legal conversation in there of why with or without a WIA, you have some fiduciary responsibilities as a utility to manage the risk. The document on the right there, the guidance document, that really is a way for the water sector to approach cybersecurity. And we have a supporting tool, which as you go through the process and kind of do an evaluation of what controls you have implemented, right? You get a nice little heat map that tells you what's left to do, right? Which is very important as you go into your kind of capital planning work, and consider a WIFIA loan or SRF loan, and what kind of stuff you want to fix and manage the risk. So I would encourage you to take advantage of this free resource, and we have some training available on that as well. Next slide. So I think this is my last one. Is your risk and resilience assessment and your ERP protected? Well, depends on where you are. Virginia happens to have some reasonably kind of explicit language, but I would encourage you to make yourself familiar with that. So if there is a FOIA request at the state level, that you know how to protect that information, because there is sensitive information in both of those uh, work products that a utility would produce that you wouldn't necessarily want just floating around on the internet. So be familiar with that. This report is available to you again up on our website, and happy to talk about that further. And I think the last slide is maybe my contact information. The materials about coronavirus are there on that first link. All the risk and resilience materials are on that the risk site. Cybersecurity is on cybersecurity. And last but not least, we have just finished doing some work with RCAP on small systems in a WIA compliance that is available up on our small systems website that you can take advantage of as well. I'll turn it back to you, Ike.
All right, sir. Thank you. First
Apologies
off,
for the technical
are
issue
you?
there.
It's okay. Technology's fun. It's always great till you need it. So for your websites that you have here, are you okay with us posting those on our webpage?
Oh yeah, this is
for
fine.
people to go and pull from the Warren site?
Absolutely.
Okay. And we have a couple questions that came up. So I'm going to start with the first one. And that is one of our folks asked, how are utilities planning for a possible fall-winter resurgency? And we have a lively discussion going on in chat. I don't know from the national level if you've heard anything from other states, what they're doing to prepare.
Yeah, I mean, so I think, so one of the challenges, right, going back to the PPE issue and be able to sustain your staff, as those supplies do become available and the pressure on the healthcare sector loosens up, I would encourage you to begin, if you haven't already, trying to stock up on some of those resources, right? So understand, what is your burn rate for masks, right? Like if they're not reusable cloth masks that staff can take home and they're disposable ones, what is that kind of return period? So therefore, how many do you actually need to keep doing what you're doing? And then, how much you can either, I know some utilities have gotten into the business of making their own sanitizer, right? But if you want Purell or whatever, start stocking up while it's available.
Okay. Some of our folks were saying that social distancing is just going to become a norm in their response plan for the next one too, and try and maintain limited contact from now through basically going forward. So I think a lot of us are starting to look at our new norm and how we're doing business, and I think that'll carry over. And some people are talking about the stockpiling of masks. Absolutely. Sure. And I believe Geneva will talk a little bit later about a second round of masks that I think we still have some masks that we can get back out to utilities for a second round. I'll let her talk about that as we get going. And then one of the other questions was on cyber, Kevin. And that was, have we seen an increase of bad actors trying to hack or hacking to take advantage while our focus was on pandemic? And, everybody exploits every opportunity.
The answer I guess the generic answer would be yes. And there was a period of time there where, everybody was, because we didn't know anything about COVID. A lot of people go on the internet and look up stuff for COVID, and like the John Hopkins map, there was like an alternative site that was not actually the John Hopkins map, and there were a number of scams that were and ransomware type things that were going on there. So again, this is where, especially to the extent that you have maybe some more of your admin staff in a telework kind of mode, they're on a home network that may not have some of the virus protections that you might have at the office and that kind of thing. And so you really want to look and be vigilant about the protocols for, connecting from that remote site into, company networks and things of that nature, because there has been an increased level of activity. And I don't know, there was just some work earlier this week on increased traffic against critical infrastructure. And that's going to be an ongoing thing. And remember, right before COVID, we had the target attack on the Iranian general in Baghdad,
Correct.
and so Iran has did cycle up, and there was increased kind of what I would call traffic or sniffing on sites, if you will, and then versus directed attacks. But their memory is long, and they are quite patient, and there is definitely capability there in other sectors, including Russia and China, that will seek to take advantage of not only the COVID situation, but also, all the protests and that are going on and creating strife that are going to drive people to look online and create potential vectors to infiltrate your network. So be
Absolutely.
vigilant.
And these are also for the folks that are listening, these type of events, the COVID, the unrest, even when we start getting the hurricane and we're starting to see a stressing of federal response, for some of our outside players, these are great recruiting opportunities for some of these cells and these groups. So there's both sides. There's the impact of people trying to get into your system, and then you're going to see an increase in recruiting by these other organizations also. And then Kevin, are you able to talk about thermometers at all?
Oh yeah, sure.
Now.
There was I don't know, kind of lost track time here with all the COVID stuff, but long story short, there here a week or so ago, FEMA did release non-contact infrared thermometers to all the states. Okay, unlike the masks, these thermometers went direct to state emergency management, or that's the easiest way to describe it, from FEMA. A utility, we put on an advisory, a utility could make a request to get one or more of those through their local city or local emergency management. And then the decision of allocation would be made, in our case, in Richmond. And so some utilities in some states, I know, once I told them that, they went ahead and they were successful. In other states like California, the allotment had already been allocated and distributed by the time the utilities made the request. So I don't know what the status of that is. It wasn't, I'm just the messenger. So make the call. Maybe you guys have some insights on what's going on in Richmond and how they're handling that. But the opportunity was there. I don't remember the exact number that was allocated to Virginia.
Gotcha. Okay. Yeah, I just want to make sure people understand that thermometers will not. Virginia warn's not going to be the issuance for thermometers like we were the mask. It's going to go through those emergency management agencies. I do not have a touch point as to where that is in the system right now, Kevin, or for anybody that's listening, as far as who's gotten what or how they've been distributed. I know there's some conversation about who can take temperatures at the utilities. Each utility is approaching a little bit different, because for some people, taking the temperature is actually a quote unquote medical procedure, and you don't want your supervisor doing it. For others, it's not looked at that way.
Yeah, there is some EEOC guidelines that have been issued to deal with the ADA and HIPAA rules associated. Part of it gets into whether or not you're actually tracking, like, oh yeah, Ike's temperature was 98.6 today. It was, 98.6 tomorrow. If you're documenting it, then you start getting, if it's purely just screening, then that's part of the issue. I can send that to you if you want to share that with folks.
I think that would be good. I know a lot of different utilities are getting different input from their HR people and from their legal teams as to what they can and can't do. And I can't speak across the board for how your utility should approach this.
Yeah, again,
Definitely
this is
talk to
just
your
the
HR
guidance at
folks
the
and your legal
federal
people.
level, and y'all got to make the
Absolutely.
risk management decision in-house.
Absolutely. All right. We'll keep watching the chat. If any more questions come up, Kevin, are you able to stay with us to the end?
Yeah, I'll hang on with you here. Sure. Thanks.
Okay. And we'll move on to the next slide. All right. So current our situation reports. As of right now, we've had no new information coming in from VDH DEQ. I know VDH is working on certificates. We got a number of certificate requests from our last webinar. And so we're going to keep you updated as we get more information on that. We've got some conference updates. The Virginia Rural Water Association conference has been canceled. Short School is going to be online or web-based or virtual. And Water Jam is also going to be virtual. And I was going to ask Geneva if she wanted to speak on that right now.
Sure, I'd be happy to. If you have not already heard or gotten an email, Water Jam will be virtual this year. It's going to be opening up on September 14th and running for a period of 3 weeks. So the information will be available through an extended period of time. We don't expect anybody to crash in all their sessions and training and learning in a 3 to 4 day window. So we have opened up that window in order to give people plenty of time to get the training that they need. We're currently working on the content and what all will be made virtual, but we're confident we'll have a very large number of presentations, technical knowledge and training, specifically focusing on water, wastewater credits. That's going to be a big emphasis for us because we know that people are needing engineering as well as their water, wastewater operator credits. So we're going to put a focus on that. We're also going to try and engage some fun, some networking. We're going to have a virtual exhibit hall. If there's an issue, a vendor that you need to reach out to, some new product that you want to take advantage of and take a look at, we're going to have a full virtual exhibit hall and just do the best we can to make it as fun and interactive as we can, but all from the comfort of your own home or office. We'll all be staying put while we engage in Water Jam. So again, registration will hopefully open mid-July. We haven't set an official date, but we're aiming for July 13th. And at that point, we hope to have a full slate of presentations and a listing of all of the items that will be available through Water Jam. I also see a little note here about the water and wastewater short schools being virtual. Tech, the health department, and DEQ are all working on those details as well. My sympathies go to you because it's a lot of work getting all of those things switched from in-person to virtual. And I can imagine that they're working behind the scenes as best as they can. So please be patient with all of us that are trying to change up formats and change up presentations. We will all get information out as quickly as we can. And I highly recommend going to websites. If you come to the Virginia Section website, to the VWEA website, to the Virginia Tech website, and I believe there's links from the Health Department and DEQ back to the short schools that are listed on the Tech website. That is where we're going to find the most up-to-date information that we have available. We'll be posting it there. And so stay tuned. July will be really an active month where you'll get a lot of information.
All right. So if anybody does have trouble finding that information, by all means, our email addresses will pop at the end. You can definitely send us an email. We'll coordinate and get you to the right place. Right now, like Geneva said, look at the AWWA site, look at the DEQ site, the Virginia Tech site, and the ODW VDH site for these schools as they're coming forward. Did I miss anybody, Virginia or Geneva?
Virginia, the VWEA as well from wastewater, VWEA.org is a great place to start as well.
Perfect. Okay, I think we're ready for the next slide. All right, so here's our COVID-19 mapping. Total in hospitals currently is 5,692. Total deaths to date is 1,583. We started to see a little bit of surge, especially after civil unrest, and we started moving into phase 2. it looks like those numbers are starting to kind of plateau again, and I think that the steep climb is coming up. So our next slide here, COVID-19 map, is showing that our climb is slowly starting to come back down on the backside. I don't think that we'll go a day where we don't have any COVID things to report in the near future, in the next 2 to 3 weeks. Hopefully we get to a point where there's no new COVID cases, and then we'll see how the second round goes. Scott, did you want to speak to this? Because you were talking about how you're seeing some increases out where you guys are at.
Yeah. If we want to flip over to the next slide, it's probably a good segue into it. UVA, this is the current COVID surveillance dashboard from the UVA model that's specific to Virginia. And if we can go one more slide. IHME, you can see the overall trend for the state. That's the important thing to note here. Confirmed infections, what's expected, the line staying relatively stable. And then let's go to the next slide. This is the slide that we referenced in the past, and the infection rate is really the critical element. Virginia's dropped to 0.86, and so that indicates a decline in overall cases. To a large extent, this is going to be driven by your population areas, like Northern Virginia, where we were seeing fairly dramatic increases in COVID cases. And we'll talk about this a little bit later on, the risk we're going to have, because pandemics are local. We have the local outbreaks, and so we're beginning to see that crop up across the country, and we'll talk a little bit more about that. But overall, the infection rate for all of Virginia, it's critical that we stay below 1, so that we're seeing an overall decline or slowdown in new cases. But again, there's some things that we need to be aware of, because the risk for utilities is to look at it. We all have kind of response fatigue at this point, and so we'd like to get back to normal operations, but there's some things we're going to flag for you to just be thoughtful of as you enter into future phases.
I did miss one small update from DEQ. I apologize, and Scott, I'm going to ask you to help me, because English is not a gooder language for me.
Yeah. On DEQ, we're aware that some dental offices, because of the pandemic response, had reached out to DEQ about delaying the dental amalgam rule. A lot of the pretreatment staffs are familiar with this. It is a new program that is a touch point for your pretreatment staff. It's our current understanding that DEQ has said there's no need to delay compliance with that program. Fundamentally, this is a requirement that the dental offices install amalgam accumulators in the office, certify that they have a program, and so that's going live right now. So a lot of utilities may be getting communications from your local regional offices with regard to that program that is going to march forward on the current anticipated schedule.
Perfect. Thank you, sir. All right, so for WARN updates, thus far, we haven't had any emergency requests either around COVID or other items. Primarily what we're reporting here is our COVID request, but like I said early on, COVID is not the only thing WARN can help you with. We can help you with many, many things. Maybe you just have questions, kind of like what's going on in the chat window right now, that we can help and reach out. So by all means, you don't have to wait till we have a webinar. If you have questions, send them out to Scott, I, or Mike, or even Geneva, and we will definitely get to the bottom of them and get you some answers. Because if you have those questions, I'm sure other utilities have the same questions, so by all means. And then we have some new WARN members we'd like to welcome. Town of Stafford has signed on, and is their paperwork 100% done now, Geneva?
Yes, it is. Their users have been created in the database, and they are able to get connected.
Awesome. And then, as I talked about before, we have some mask replacements. Geneva, you want them to go through the same process they did before? I'll let you speak.
So if you will go to the website, warn.org, and you will get the link to our resource page. Right, very much located at the top is the link for requesting masks. We went through the first wave and we provided more than 40,000 masks out to well above 150 different utilities throughout the state of Virginia, which was absolutely amazing. We are so excited to be a part of that effort. But the great news is we have more masks available. We received more masks than what we had asked for, which was a wonderful benefit that FEMA and EPA did for us. So if you are going into the second wave, or if you need additional for your warehouse to just be supplied in advance, we are at the point where we can now do a second wave, a second shipment of masks. So again, same process, same procedures. Go online, select the form, type your information into the form, and it asks you just a few specific questions that FEMA needs for their documentation. And then once we can get those processed, we'll get them back out. Masks traditionally are going out somewhere between 7 and 10 days from the time that the request comes into the office. So we can turn them around pretty quickly because we do have them in stock now. And so if you have a need for masks, don't hesitate to let us know. We'll get you what we can. And the rate for distribution is still the same. They're going to come in the same packs, 5 masks in a pack, and that one pack would go to an employee. So we're not asking that you pull packs apart or, divvy them up once you get them. 1 pack per employee. So that keeps the sanitation of the masks intact. No one's having to handle them except for the individual that's wearing them.
Perfect. So I just got a message from Isla White. They've got approval through their board, and they're going to be submitting their paperwork here pretty soon. So we'll make sure and get you on our list too. But we're happy to have you join the Warren family. For mask replacements, I really want to thank Kevin Morley and Dawn Eisen with the EPA because they worked really hard to make sure that the Warrens, all the national Warrens, were able to get these masks for the states because, as everybody knows, PPE for a long time was a big issue for all of us, and to be able to offer that to utilities, Kevin and Dawn Eisen really took the lead on that. And then for Virginia, Geneva, Scott, and Mike, they really worked hard to make sure those masks got out to all our utilities that requested. All right, so now we're moving on to phase 2 highlights. Return to work practices. We're looking at starting to bring people in. Some of that posturing, though, still says that, if you have folks that are vulnerable or susceptible, try to work them, keep them working from home. And then just keep in mind that as we talk about that working from home policy, that kind of opens us back into that cybersecurity realm. As we have more people working from home and logging in, that's more touch points coming into our system that we have to be cognizant of and make sure that we have security in place for. Return to visitors. At some point, we're going to be opening our doors to let our citizens come in and either pay their bills, dispute a payment, request services. And Scott and I kind of talked about this. Scott, did you have anything you want to add here as far as opening things back up to letting people in the building?
Yeah, actually, I can maybe hit on some of it in kind of the next slide as we.
Okay.
Where we stand, the governor on June 16th announced, obviously we're not ready for phase 3 in the Commonwealth. There's not confidence in the current data. That's been kicked down the road. We think most people heard it or saw it reported to next week. And so as we obtain details for phase 3, we'll try to share those. Next slide. And that, like Ike said, that's going to be pertinent to your own internal planning. But I do think it's important to point out we've seen localized outbreaks occurring in Virginia in phase 2. Henry County, Martinsville, they only had 33 combined cases phase 1, and now they're up to 266. There was a quote from Henry County Administrator, Mr. Hall. I think there's a real possibility we don't go to phase 3, we go back to phase 1. Roanoke City, Roanoke City, which is part of our service area, phase 1 had 120 cases. As of June 16th, Roanoke City has 270 cases. And the interesting fact on that one is it's not connected to a large institutional outbreak. It's a specific segment of the community in Roanoke, but that's a little disconcerting because usually those type jumps are associated with large institutional settings. Greensville, 50 cases. Now they're at 342. So we talked about the incident rate in all of Virginia is 0.86, but Roanoke City's infection rate's 1.16. Henry County's at 1.18, Greensville at 1.46. And just of note, Fairfax has dropped their rate to 0.9. So that is a large component of seeing the overall state data drop because they were driving a lot of numbers in Northern Virginia. However, it's essential that each utility look at and understand the area that they serve because we're seeing that across the country are localized outbreaks. Next slide. So we're starting to see, again, the similar experience across the country. These are some recent headlines, the coronavirus spiking in certain states. Health officials experiencing concern, 20 states, some social media communications showing individual states where we're beginning to see, again, a rapid escalation of cases. Next slide. So many of these cases are being connected to workplaces, group gatherings, church funerals. These are some recent headlines just from our surveillance of the news. Most of us have seen West Virginia's having some outbreaks that are associated with churches moving back into new operating phases where that's infecting larger portions of their congregation. Oregon's having a current outbreak. It's tied to Pacific Seafood. There's 100 employees infected, and so they're really scrambling to trace and contain that outbreak. And then North Carolina is still noting that there are COVID outbreaks at meatpacking plants. So again, the takeaway I think that's important for utilities is local surveillance is critical in this phase of utility operations. Consider modification of your internal phasing to account for your actions if you have a local outbreak. And then we have a poll that's another aspect of this. Has your organization begun or are you considering starting contact tracing or tools to do contact tracing as we move into future phases? And then the answers are yes, no, not sure, or doesn't apply. Ike, you want to take over the results?
Yes, sir. So we have 13% said yes, that you have begun or are considering starting contact tracing. 37% are saying no, that you've not begun or considering this contact tracing. 39% are not sure. 11% say that does not apply. For those of you that are not sure or answered no, if you need more information on this or you need to have a more in-depth discussion of this, by all means, you can get a hold of us after the webinar, and we'll help you out there. Jim Cherry says that is the city's health department's role to do the contact tracing.
And that's a good point.
Go ahead.
That's a very good point. However, as employers, we should recognize they're still going to come back to our HR. They're still going to look for that assistance to supplement their contact with employees because we're one of the parties they're going to contact. And so we touched on it in an earlier webinar. Many folks, Everbridge is a nationally used messaging system for emergencies. Everbridge has some unique capabilities. So utilities that have internally adopted a emergency notification system utilizing cell phones, text messaging, You may want to check with your service provider because you may already have a very effective contact tracing tool. A lot of those businesses have been building in some additional capabilities. So just keep that in mind and be aware of it if you are asked or you find the need to have to do contact tracing.
Perfect. All right, so we added a slide here called Evolving COOP. So with pandemic, civil unrest, and hurricane, typically we think about the emergency response piece. But as a lot of us are looking at, this long-term employees working from home, civil unrest, where we have to move pieces and maybe reapproach how we do business or where we work from, hurricanes causing us to dislodge. Those are pieces that actually work into our COOP plan. So how you're going to do business, your new norm, how you're going to go about doing that. We need to make sure we're taking these lessons learned as we have them now, as we're living them every day, finding out what's working, what's not working, and make sure we roll that into our COOP. And we definitely want to make sure we capture some of these pieces in our ERP. As you heard Kevin talk about, ERPs are coming due in September for this first round of the large utilities, but the other utilities will have these pieces too. We need to be capturing that information. All right, next slide. Best practices, taking employees' temperatures. We talked a little bit about that. I don't think we need to talk on that anymore. That's something you definitely need to talk with your HR and your legal team on how you're going to go about doing that for your entity. And we'll get that guidance document up as soon as Kevin gets us to us. It'll be hung on the Warren site. Messaging matters. Be aware of how you are saying, not just what you are saying. So are you saying something in a panic? Are you saying something not well thought out, or are you saying something that makes other people's stress levels go up, or are we getting that message out in a clear and calm manner? Communication planning is a very important thing in all these emergencies, especially these emergencies that go on. We need to make sure that we're communicating with our employees, communicating with our citizens, communicating with our response partners. So they know what your capabilities are, what you are able to do. All right, next slide. Geneva, do you want to put your poll question up here and then talk to this slide?
I will do just that. So because we're at the end of the hour, getting very close to 2 o'clock, I'm going to go ahead and just put the poll up about continuing education credits. Most of you are familiar with that. But in the meantime, we wanted to make you aware of 2 particular webinars that have come across my desk, and they are keeping the water on during and after the COVID pandemic. This is being sponsored by the EFCN, which is a finance network out of, well, they're all over the state. The one that's closest to us is down in North Carolina. They're doing a free webinar on Monday, June 29th, and it goes from 2 to 3 o'clock. It is great information that will help you on the financial aspect of keeping the water on, looking at customer assistance programs. If you don't have one, how to develop a customer service assistance program, and those types of things. In addition, there's the continuity of operations plan template for drinking water and wastewater laboratories. I just talked about a COOP and what should be in your COOP and making sure that you're reviewing it. Well, the EPA Water Laboratory Alliance is doing a webinar on Tuesday, the 23rd, from 1 to 2 p.m. in the afternoon. So if there's anybody that would affect in the laboratory realm, please be aware of that, and hopefully you can take advantage of that free webinar. So just trying to give some information. We'll post links on our website. As always, go to our resource page. Everything we talk about here will be coming across and available through the resource page. I'll go ahead and end the poll just to let you know we did get your request for credits. Scott will be working on credits in the coming week or 2. If you haven't seen an email from them in a little while, don't worry. It's not that he hasn't marked you as being in attendance. It's just we're doing them in batches so that we're not sending out an email every single webinar. We're waiting 3 or 4 webinars worth, and then we'll send a new transcript, which will take you from the beginning of this series all the way till now. So we plan to have one sent out by the end of the month because this is the last webinar we have for June. That will be a transcript with everything that you've had thus far in this webinar series. If you have any questions, don't hesitate to email Scott at scott.smith@vaawwa.org.
Geneva, can you tell the website for people to go back on and get the past recordings of the webinar? We've got a couple people in the chat window asking if you can.
Sure. So past webinars are also on the virginiawarn.org website. And because we have just a moment, we've taken the quiz for credits. I'll just flip on the screen here. This is the resource page. It can be located simply by going to Virginia Warn. This is the main page for the Warn. And right here under news, you'll see a link to the resource. You'll also see a link to the bi-weekly webinars. If you click on that, it just lets you know how to register if you're not already, and then a very long list of all past recordings. So you can go get slides in particular, the Zoom recording or the YouTube recording. All the links are available since the beginning of this webinar series. Please feel free to go take a look and remind yourself of anything that might have been presented in a previous webinar. And then all the new items will be right here in the center section. I've dedicated this to anything that's new. And in fact, one thing that we haven't touched on, but is in the civil unrest preparedness checklist. We were able to get one of those for helping utilities prepare during times of civil unrest. And there's a checklist there that you can download and use specifically for your utility.
Okay. And I just want to reiterate, all these items right now are forward facing. So whether you're a WARN member or not, you should be able to access these and use these to help you build your ERP or stay on top of everything. And we really do hope everybody was able to get some good takeaways from this. I think the next slide is just our contact information. So I want to thank Kevin Morley for presenting today. There was a lot of great information. So thank you, Kevin. If you're still on the line, we appreciate it.
You bet.
If anybody has, thank you, sir. If anybody has any last minute questions or anything they want to post, we'll leave this up for just a minute, but otherwise, thank you for logging in today, and we look forward to seeing you in 2 weeks.